Okay, before we actually consider a patient for bariatric and metabolic surgery, there are several criteria that they need to fulfill and satisfy. There are a lot of criteria. The two most common is from the American Diabetes Association, which set a body mass index of more than 37.5 for Asians, regardless if they have diabetes or other obesity-related comorbidities. Now, if the BMI is less than 37.5 but higher than 32.5, for as long as they have diabetes or another obesity-related disease, then they could also be a candidate for this type of surgery. Now, for those who has a lower than 30 BMI, if their BMI is more than 27.5 and they have uncontrolled diabetes, then they can also be considered for this type of procedure. Now, the International Federation for Surgery of Obesity and Diabetes, the Asia Pacific chapter, came up with a separate type of criteria that is tailored for Asian patients, mainly because we see a lot of obesity-related comorbidities even in lean Asian patients. So the criteria is as follows. If they have a BMI of more than 35, regardless if they have obesity-related diseases, then they are candidates for bariatric surgery. Now, if their BMI is less than 35, but it's more than 32.5, then this patient can also be candidates for bariatric surgery. And lastly, if their BMI is more than 27.5 and they have uncontrolled diabetes, then metabolic surgery can be recommended for these patients as an alternative option for them. So aside from the usual amount of weight that the patient would lose, more importantly, patient would see an improvement in what they call their obesity-related diseases. First and foremost is diabetes. After metabolic surgery, you usually see around 20 to 70% improvement and sometimes even resolution of their diabetes. You would also see improvement in hypertension, in cholesterol. They would also see an improvement in fatty liver disease. You would also see an improvement in their joint-bearing areas, such as the knees and their backs. Now, if the patient is a female patient in the reproductive age with irregular menses, you'd also see an improvement in that, which is caused by what we call your polycystic ovarian syndrome. So these are some of the benefits that the patient would actually reap from bariatric and metabolic surgery. But aside from all of these improvements, what is more important actually is a better quality of life for these patients. And more importantly, a reduction in the complications associated with diabetes and obesity, which would lead to a better lifespan and a reduction in their morbidity for these patients. Since this is an invasive type of procedure, like any other types of surgery, we divide complications into a major and a minor complication. For major complication, the rate for bariatric surgery is around 1 to 3%. Now, for minor complication, that goes up to around 5 to 15%. Now, minor complications would include bleeding, infection. Major complication would include leaks. And major complications would actually be sometimes procedure dependent. Now, for those who would undergo gastric bypass, there would be a tendency to have leaks around the staple line. Patient would have a risk in developing internal herniation, which would result into small bowel obstruction. Now, the more common minor complications would also include nutritional deficiencies. That's why patients who would undergo bariatric procedure, we actually recommend that they would be supplemented with multivitamins, vitamin D, calcium, and iron to prevent these nutritional deficiencies. International data would show that the length of stay is around 3 days for patients who would undergo these types of procedure. In the Philippines, what I do with my patient is I usually admit them the day before the surgery, and then after surgery, I usually observe them for 24 hours. So for my patients, they usually stay around 3 to 4 days. I'm Dr. Emmanuel Astudillo, your bariatric and metabolic surgeon from the Medical City Clark, your partner in health.